introduce myself, I am Mushaetatun Maryam, and you can call me Nichole. I'm a first grade midwifery student of Poltekkes, Kemenkes, Tasikmalaya, Cirebon. And now I'm going to show you how to insert a contraceptive implant properly. A contraceptive implant is a small flexible plastic rod that inserted the underskin of the upper arm to prevent pregnancy. It works by releasing hormones that inhibit ovulation and thicken cervical mucus to prevent fertilization. And it's effective for up to 3 years. Before we get to the procedure, I will show you the equipment needed. The equipment includes contraceptive implant set, sterile gloves, antiseptic solution, local anesthesia, syringe and needle, sterile bandage, cotton, ball, anatomical forceps, and last, and sharp disposal container. And now, let's move to the steps. Hi, good morning, Miss Dita.
Morning.
I'm Nichole, the midwife on duty this morning. How are you doing, Mrs. Dita?
I'm good.
Oh, glad to hear that. Before I get started, could you please tell me your full name and date of birth?
Sure, my full name is Dita Sarah and my date of birth is June 16, 2000.
Okay, have you ever used an implant before?
No, this is my first time using an implant.
Alright, before the procedure, please allow me to explain it first. A contraceptive implant is a small, flexible plastic rod that inserted the underskin of the upper arm. It works by releasing hormones that inhibit ovulation and thicken cervical mucus to prevent fertilization, and it is effective for up to 3 years. Do you understand the explanation, ma'am?
I got it. It's so clear and I understand.
So, can you explain what an implant is?
A contraceptive device inserted into the upper arm to prevent pregnancy for releasing hormones that inhibit ovulation and thicken cervical mucus to prevent fertilization, and this is effective for 3 years.
That's absolutely correct. Okay, now let's move to the steps. First, make sure the position is in a comfortable position. Next, prepare the equipment and materials for the implant insertion. Next, wash your hands with hand sanitizer using 6 steps technique and dry them. First, open hand sanitizer and apply. Rub hands palm to palm in circular motion. Rub right palm over left dorsum with fingers interlaced and vice versa. Rub hands palm to palm with fingers interlaced and rub back of fingers to opening palms with fingers interlocked. Rotationally rub left thumb clasped in right palm and vice versa. And last, rotationally rub left palm backwards and forward with right fingertips and vice versa. And dry the hands. And then wear gloves. Next, pour the antiseptic into the bowl. After that, dip the cotton into the antiseptic using anatomical forceps. The next step is apply it to the arm where the implant will be inserted and let it sit for a moment. Next, put the local anesthesia into the syringe. And then inject into the arm where the implant will be inserted so the patient doesn't feel pain during the procedure. Okay. After that, insert the contraceptive implant. The next step is hold it for a moment with cotton and make sure the implant is properly has placed. And then clean the remaining blood and antiseptic. Next, cover it with a sterile bandage. And the last, don't forget to dispose of the needle and other soft instruments into a soft container. The implant insertion procedure is now complete since we inserted a device into your arm. Your body will need some time to adapt. So there may be some side effects. For example, you feel with pain as the anesthesia gradually wears off. And there may also be bruising or swelling. You can come back for follow-up examination if there are any signs of infection or complication. So that's the explanation. Do you have any questions?
No, ma'am, your explanation is good. Thank you.
Alright, ma'am, if there are no more questions, the procedure is finished. Thank you for your trust and cooperation.